Hello and welcome to Pace Hospital's podcast. Today, we are discussing a critical yet often overlooked complication of diabetes, that is, diabetic kidney disease. Joining us today, Dr. Kishore Kumar, consultant nephrologist and kidney transplant physician, having wide expertise in treating and managing diabetic kidney disease. In today's episode, he would like to explore what diabetic kidney disease is, its types, causes, risk factors, symptoms, treatment, and how it impacts people's life. Dr. Kishore Kumar, thank you for joining us at Pace Hospital's Hitech City. Let's understand exactly what is diabetic kidney disease.
Kidney disease, which happens because of diabetes, is called diabetic kidney disease. So all patients who have diabetes are at risk of developing diabetic kidney disease.
What are the main types of diabetes?
So there are two types of diabetes, mainly type 1 diabetes and type 2 diabetes. Type 2 diabetes is the most common type, which occurs generally in people who are little older and who have a family history and who are little obese or who are hypertensive. And these patients, there is resistance of insulin hormone in the body, and because of which the insulin levels are inadequate to control the blood sugars. So this is type 2 diabetes. Type 1 diabetes is the one which occurs in people who are little younger, in which there is destruction of the insulin producing cells in the body, so that the insulin levels are less to control the blood sugars. So both type 1 and type 2 diabetic patients are at risk of developing diabetic kidney disease.
What are the early signs of diabetic kidney disease?
So let's talk about the symptoms of diabetic kidney disease. So diabetic kidney disease can be silent initially. Patients may not have any symptom. So these type of patients will be diagnosed generally by routine checkup or routine health checkup, which we do, in which the urine shows some protein leakage or abnormal elevation of the creatinine levels is found. And sometimes patients can have symptoms. The most important and common are these swelling of the legs, like above the ankles or the feet. The patient has edema, which generally is a pitting type of edema, or early morning patient can have facial puffiness, and sometimes patient can have frothing in the urine. Once they pass urine, there will be like a foam, like detergent like foam is formed. That generally few patients find it, and few patients will have features of advanced renal failure, like they have weight loss, they will have decreased appetite, some patients can have vomiting, some patients can have decreased sleep, they can have nausea, or they can have some changes in the skin or itching, or they can have decrease in urine output. So these are the symptoms of kidney disease, which generally is common for many kidney diseases. And the main thing here is the leakage of protein in the urine, which generally presents like swelling of the feet or the face and frothing in the urine.
So, doctor, what age group is most at risk for developing diabetic kidney disease?
As I've already told, type 2 diabetes is generally more common than type 1 diabetes. So type 2 diabetes patients are little older age group patients, like after 40 years. But type 2 diabetes nowadays can happen at younger age group also. So generally majority of the patients are more than 40 years who have long duration of diabetes, or who have uncontrolled sugars for months or years together. These are the mainly group of patients in whom diabetic kidney disease is predominantly found.
How frequently does diabetic kidney disease occur in diabetic patients?
So some people say India is the world capital of diabetes. So there are so many millions of people who are suffering from diabetes in India, and one of the leading causes of kidney failure all over the world is diabetes along with hypertension. So diabetic kidney disease is one of the most important causes of kidney failure overall, and majority of the patients who end up in end-stage renal disease requiring dialysis or transplant are having kidney disease mainly due to diabetes.
How diabetes leads to diabetic kidney disease?
So what happens in patients who are having long-standing diabetes or with uncontrolled blood sugars? So whenever there are more blood sugar levels, what will happen is it will lead to a damage of the filtering units of the kidney. So kidney has approximately 1 million filtering units called nephrons, which are basically small blood vessels or very small blood vessels. So very high blood sugar levels will lead to overloading of this kidney functioning units, and it will lead to damage of that very small blood vessels in the kidney. So it will lead to diabetic kidney disease. And patients who are having diabetes also have hypertension commonly. So along with hypertension and along with high blood sugars, it will lead to more pressure on these filtering units called nephrons in the kidney, and it leads to diabetic kidney disease. Patients who are having very high blood sugars which are uncontrolled for prolonged duration, like for years together, who are having this high blood sugars, they are at risk. And people who are having a family history of diabetic kidney disease, they are also at risk. And people who are having hypertension, high blood pressure which is uncontrolled, are also at risk of diabetic kidney disease. And people who are obese or people who have very high lipid levels or cholesterol levels in the body, these people are at more risk of diabetic kidney disease.
So, doctor, how often should diabetic patients undergo testing for signs of kidney disease?
As I've already told, there are two types of diabetes, type 1 and type 2. In type 1 diabetic patients, after 5 years of diagnosis of illness, generally we have to check for this damage to the kidneys or also eyes. And in type 2 diabetes, whenever a patient is diagnosed, immediately you have to check for the end organ damage, like the damage to the kidneys or eyes. So, and every year after diagnosis of type 2 diabetes, you have to check for the kidney disease.
What tests are used to diagnose diabetic kidney disease?
So first and foremost is the complete urine examination. Normally in urine there should be very small amount of protein, or in complete urine examination there should be nil protein. So in diabetes patients who are having diabetic kidney disease, there can be a loss of protein into the urine, which is majority of albumin. So if there is increase in the albumin in the urine, it is found in the complete urine examination. If albumin is found, we can quantify that albumin in the urine by doing a spot test or a 24-hour urine collection. So we can measure the albumin level, whether the albumin levels are microalbuminuric or macroalbuminuric. So if the protein levels is high, then we call it as macroalbuminuric. So if it is micro or macro, if protein is there, it means that kidney is damaged, it is leaking, the albumin is leaking. So the first test what we do is complete urine examination, and we can quantify the albumin levels. And the second one is the renal function test. So renal function test includes this mainly urea, creatinine levels. So diabetic kidney disease patients not always have an elevated or abnormal renal function test. So initially first stage is the increased levels of protein in the urine. Later, when the kidney damage increases, there will be levels of creatinine and urea levels elevation. And the other test what we can do is we can check for the eye checkup to look for the retina. In the retina, we look for the diabetic retinopathy changes. So the presence of diabetic retinopathy changes will give us an indirect evidence that the patient is having a damage to very small blood vessels which are present in the eye. In the same way, the same blood vessels which are present in the kidney can also be damaged. So it is an indirect evidence that patient may be having a diabetic kidney disease. So any patient who has this abnormal protein in the urine along with the diabetic retinopathy, it indirectly tells that patient has diabetic kidney disease, but not always it is diabetic kidney disease. So we generally will be cautious to rule out the other causes of kidney failure in these patients, and then only we confirm the diabetic kidney disease.
What are the effective strategies for treating and preventing diabetic kidney disease?
First and the foremost, to prevent the diabetic kidney disease is to keep our blood sugars under control. Generally, blood sugar monitoring will be done by doing the preprandial and postprandial blood sugar levels. Like before eating and after 2 hours of eating, we check the blood sugar levels, and that should be under target range. Or we generally check for the HbA1c levels. So the target HbA1c levels generally is below 7. Is the target for people who are very young and who have a prolonged life expectancy. But patients who are little advanced age, like more than 60 years, with many comorbidities like heart disease or little fragile patients, keeping a very low blood sugar levels can be counterproductive in them. So we generally go little, we keep the HbA1c levels little on higher side, like the target will be really below 8 or something. And the second one is to keep the blood pressure under control. And to do these things, we have to take the medications regularly. It will be an anti-diabetic medications like oral drugs, or it can be insulin. And for hypertension, the antihypertensive drugs prescribed by doctors should be regularly taken. And another important aspect is to keep the diet under control. Diet also helps us to control our blood pressure and also the sugars. And physical activity, regular physical activity will keep the blood sugars and blood pressures under control. And other medications which are required, like your lipid control medications or cholesterol control medications. So for the treatment of diabetic kidney disease, after the confirmation of the kidney disease due to only diabetes, what we do is we try to identify the stage of the kidney disease in which the patient is. Few patients will have only protein leaking into the urine, with the other renal function tests which are normal. So, and a few other patients will have abnormal elevation of the creatinine. If the creatinine is elevated along with the protein in the urine, we have to stage the kidney disease, whether it is stage 1, 2, 3 or 5. So what stage the patient is in, because the treatment targets and what we are expecting in the future from this patient will depend on the stage of the kidney disease. So patients who are having only protein leak in the urine, first we try to quantify what is the level of protein, if it is very less or very high. So if the protein level is less or mild, what we do is, as already told, we will control the blood pressure and blood sugars. Along with that, we try to decrease the protein in the urine by giving few medications. These are called like angiotensin converting enzyme inhibitors or angiotensin receptor blockers. These drugs are started in a low dose, and as the patient tolerates it, the doses of these drugs are increased and the protein level in the urine is monitored to keep under the target range. And recently, a new type of drugs have been approved called SGLT2 inhibitors, sodium glucose co-transport inhibitors. These drugs act on the kidney and they cause leakage of the glucose into the urine. So in that way, they keep the blood sugars under control. Along with that, they prevent the leakage of protein from the kidney. So these are the two types of drug options which we are having currently, and this type drugs like SGLT2 inhibitors, there are specific indications for to be given. Like not all patients with kidney failure can be given. Like advanced kidney failure patients, currently they are not indicated. Patients who are having a mild kidney failure or only protein leakage in the urine, these patients can be given these drugs.
Thank you, Dr. Kishore Kumar, for sharing crucial information regarding the diabetic kidney disease to our listeners. If any of you have any further questions regarding diabetic kidney disease, please don't hesitate to consult a nephrologist. Remember, early detection and proper management can make a big difference in protecting your kidneys and overall health. We will see you soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay proactive, and take care of your health. Thank you.